Health and Human Services Board for December 17th. Thank you all for being here on a slightly different night than we usually meet and for the Christmas season. Let the record show that Supervisor Bashan, Supervisor Hagan, Supervisor Morehouse, Supervisor Steen are present, Dr. Hall and Ms. Rudy online. So we do have a quorum. We need to have a look at the minutes from, let me pull this up, a while ago, October 23rd. Any standout corrections? All right, I need a motion to approve. Dr. Hall, second. Supervisor Steen seconds. Any further discussion, additions or corrections? If not, all in favor say aye.
Aye.
Aye. Any opposed? Minutes for October 23rd, 2025 are approved. Do we have any public comment? Not in the room. Anything online? All right, moving on. Next meeting date, which seems like a really long ways away, but January 22nd, that's a regular scheduled Thursday, 6 p.m. meeting. Okay, everybody? All right, moving along. And it is our pleasure to move on to the bright spot. I will let Paula make the introductions if she's able.
Might be a slightly occluded spot.
There it is.
I wanted to start it, but
Supervisor Bashan, can you see this? Okay. Ms. Rudy? I think that's yes.
Okay.
Okay.
I have it big on my screen, but it's small on there, so we'll see how it goes.
You can go up and expand it.
There it is. Today, that means a Mighty Mouse.
I know, right?
Yeah, it is. See, it's not clicking forward, Dan. See how that is?
Yeah.
Don't we all just love technology? Hi, Supervisor Bashan, you're large.
It's the right spot. It's the right spot.
It's the bright spot. Yeah. Oh, we should actually pass those cookies to the other side of the room. And then the napkins too, please.
Sure. Goodness sakes, how rude of me. Rude of me.
Our apologies to those watching us online. We don't have cookies for you. And to the general public, I'm sorry we didn't bring enough cookies. There we are. All right, who's gonna, you make the introductions, but who's gonna go first, Wendy or Stacy?
Yeah. Good evening. It's my pleasure tonight to introduce you to two ladies from our clinic, our mental health clinic in Department of Human Services. Stacy Plummer is going to, first of all, give us our bright spot, and our bright spot in our department is certainly our mental health therapy dog. And Stacy is an excellent clinician for our clinic as well. So she presented this this month at our all staff meeting, because that's kind of how we do it. We present a bright spot and then we bring it back to you to hear the bright spot as well. And bright spots are something that is going right in our department, something going well that we want to brag. So Stacy's going to run through, she's got a PowerPoint. And then after that, Wendy, as the licensed behavioral health manager in the clinic, is going to talk us through the infographic and some money and changes in the department and the clinic. So Stacy, I'm going to hand off the baton to you. If you hit the button, it turns red. Yep.
So it's
Perfect.
on when it's red?
Yes, it's on, Stacy.
It's Trixie, it's opposite. All right, so my name is Stacy Plummer and I'm one of the therapists in the outpatient mental health clinic. And this is Esprit, and she is a golden retriever, 5.5 years old, that was placed with me back in May of 22. If you want to go to the next slide, there's really not much on there, but Helping Paws is the organization that I got her from. They're located in Edina, Minnesota, and they place dogs with people with physical disabilities, veterans, first responders, and in facilities. I'm going to read the definition of a facility dog from their website because it can be a little bit, I guess it's not confusing, but it's different than what you would think of as like a service dog that we're typically used to hearing about. So they are fully trained service dogs. So she is fully trained, has public access, and she actually knows how to do a lot of the things that she could do to help people with physical limitations as well, because they train them all the same up until they get a little bit older. So facility dogs work with professionals in a visitation, education, treatment, or therapeutic setting. These dogs prove on a daily basis that service can take many paths to success. Dogs may help teens feel more comfortable opening up to a therapist or provide emotional comfort to a patient confined to a hospital bed. Health professionals often note that dogs seem to sense when a snuggle is called for and can provide a nudge of motivation that helps an individual in a critical moment. So Helping Paws breeds their own dogs and then trains them from little on. They're placed in volunteer foster homes and trained for 2 to 2.5 years prior to placement. They have dogs currently at, now I'm going to forget, Stearns County and Ramsey County in Minnesota, and they had one of the dogs, Nova, I forget. They're Esprit's aunts, actually. One was on Good Morning America. They did a big segment on the first time she got, they were able to take her on the stand with a sexual assault victim that testified for like 5 hours, and the dog laid by their feet for the whole time. So it's pretty cool. They have one in a sheriff's department, fire department, St. Paul Fire Department, and there's also another one here in Menominee placed in one of the elementary schools, which is pretty cool. Let's see, you can, go on to the next one.
There she is.
Yeah, that picture's old. She's a lot more white, a lot more gray. So she is with all of my most of my clients, I should say. I have a couple that don't want her in there. One is she's just too distracting, she tells me, which is great. Then they hang out with Wendy when they can't be with me, but they assist me. I mean, she really helps in building rapport with people. She can get people outside walking a little bit easier. If I'm like, oh, let's, take her out, she can definitely sense when people need her. She'll get up and go by a client mid-session, which is helpful to me because sometimes I might not be picking up on something that she does. She interacts with like handing out notes to people. She carries this basket around, which she'll do. She carries my clipboard back and forth between the client and me, box of Kleenexes, so she can engage in those ways. In 2024, I didn't tell you the number yet, I just figured that out. So in 2024, she was with me, and this is approximate. I really tried to add carefully, but I'm not a math person, I'm a social worker. So she was with me for around 530 sessions in year 2024 with just my clients. And so far in 25, 400 and roughly 420. This year's probably a little less because she has joined me in family treatment court and treatment court. So she comes to the courthouse with me, and Judge Wagner has a little mini Esprit up on the bench with him, and she's a pretty well-loved member of that team as well by all of those teams. So with staff, I mean, she's can be a distraction when people just need that. She brightens, I mean, you see a golden and they kind of brighten your day, right? It's pretty self-explanatory. She visits during our staff meetings. She hands things out to staff, and people just, I don't know, people just love her, right? So I love this quote: the most important things cannot be measured. And I think hearing she was with for 530 sessions roughly in 2024, I think, which is something we can measure, if you will. It's hard to measure her impact just on an everyday basis, especially beyond the work she does with my clients directly, because a couple examples there, sometimes, and this was a former client, but frustrated out in the lobby, I'm able to bring her out there, distract them, and then move out the door and like, let's kind of move on for the day. And because he really would engage well with her. And that was wonderful. And probably, she can do in 3 minutes what it probably takes us humans 30 minutes to do. There was a coworker's client was having what we would call like a psychogenic seizure. So it wasn't a medical seizure, if you will, trauma-based. Really having a hard time breathing and really not quite there. And Esprit came in and sat by her and she just pet her. And you could just see like within probably a minute, and it probably would have, and no offense, right? But
Yeah.
probably would have taken Wendy and the other therapist 30 minutes, right? To try to engage. And there's been times we've had to even call EMS or law enforcement to come and help because we can't engage somebody. So that's, I mean, you just can't measure that stuff, right? And any, I guess, it's just so much good stuff. And in the when I'm walking in the lobby or even outside, I couldn't count how many times people are like, oh, seeing her just brightened my whole day, right? Like, it's just pretty cool. So other stuff she does in the county, that picture, we're at the blood drive. She comes to the blood drive and people really enjoy seeing her. Her and Rookie did a little filming thing together. We handed out stuff at the birth to 3 when they did the trick or treaters. She wore a mermaid costume. And she doesn't love costume. I was going to make her wear a Santa hat tonight, but she really doesn't like stuff on her head. So I was nice. She goes to like the community, which Wendy will talk about, the community support program. She goes to their like groups and Christmas parties, and people like to see her. So we try to get around the county, other places, and help out because people love her. So she does come with me to work, typically Monday through Thursday. But outside of work, I get asked a lot if she comes home with me, and she does. Outside of work, she's a relatively normal dog, probably has a lot more perks because she does come, like she comes to cross country meets, track meet. She comes to the gym when we're at basketball tournaments, to the fire hall. She ran a 5K. We got a puppy and she's a great big sister. So at home, she really is just a normal, like she's real chill at work, but at home, she's all over. And the next slide is her favorite thing ever is playing ball. She sleeps with it in her mouth. She gets dirty. She plays. So she's very, very astute at work. At home, she is just a normal dog that acts like she's still 6 months old. You can go to the next one too. This one is kind of ties back to helping pause. So this is Marianne. This kind of makes me get choked up sometimes, but she is the gal that trained her. So I will be forever grateful to how wonderful the job she did. And we weren't allowed to have contact. So that was the last time I saw Marianne when Esprit was placed with me, fully placed. And then we're not allowed to have contact for about a year. At 1 year, we can get the contact information and reach out. And I did, and Esprit visits with her a couple times a year. They live 3 hours away, but usually 1 or 2 weekends a year, I try to get her there, and she goes and plays with her brother there and sees John and Marianne. So it's pretty cool. They're pretty selfless individuals that can train these dogs for so long. So this is something we're doing in human services now, what I presented on last week, spreading golden glitter. So, I think I did bring the cards. So I have these little, it looks just like what's up there, the little cards and these little they're just heart-shaped gems. And then, so I randomly, not every day on everybody's desk, but put these on these little cards, and then something inspirational, whether it's like a card or some of these things, and put them on people's desk, ask them, they do some sort of random act of kindness. Doesn't have to be at work. You don't have to tell anybody what it is. It could be picking up a piece of paper. It could be helping somebody move, right? Whatever. And then there's a jar in our like work area by our mailboxes. And so the goal is to fill the jar with all of the little gems. Sometime, right? In 2026, we'll get it filled up and keep spreading that kindness. Esprit loves to stick her face in holes, her nose in holes when we're walking, and there's a lot of them around the county outside. So she shoves her nose in there and it'll just sit there. So makes you smile. So that's it. That's her in a nutshell. Does anybody have any questions?
No, but it's, as a longtime golden retriever owner, this is quite spectacular, and they are the perfect dog for this kind of work. But thank you for putting yourself out there with her. She's lovely.
Yes, thank you.
I know that Stacy talked a lot about the consumers and the interaction with consumers, but as a human services department, we have staff that hear, listen, have to do really hard stuff. And
Yep.
many times, after that, they'll go, where's the spray? Or like, because like it helps to regulate staff as well after
Sure.
doing really hard work or things. So it's not only mental health for the community, it's also for our team. So I'm appreciative of that as well. Yeah. So,
Yes.
um,
Can I just, I will have her, well, you guys can grab something out of here. I won't make her carry the basket to everybody because the reason she wasn't placed was somebody where she needs to do a lot of picking up, like a lot of physical work opening. She can open and close doors, turn lights on and off, but she's kind of like, I don't know if I want to. Somebody who she didn't need to do that very often. So like to pick something up off the ground, you but still take it. And she'll carry it around and.
What a good girl.
Staff and- But-
I know, that's kind of what's that look. Oh, good girl.
mhm.
Good job.
Never seen her wave before. Oh, great.
Oh, do I have the most current one?
It's been a long day, Stacy.
Yeah.
She's
I know,
done.
I know, she's like, I don't want to do that.
Madam Chair, may I ask a question?
Sure.
Yeah, absolutely.
Thank you. The program, is it a relatively new program then? What's the history behind how this program became to be here and what were the choices that led to it? Like, I love it. What was the lead up to it being facilitated here?
For like helping pause in general or just like her place at Dunn County?
Helping Paws in general here in Dunn County, yeah.
Okay, so Helping Paws themselves has been around since 85. They started with conjunction between the University of Minnesota as a pilot study for animal and human interaction. And then in 1988, they became their own organization and then trained service dogs. And the first dog place name was Alpha. And so I don't know at Dunn County exactly. So I was in a previous role, worked in adoptions back in 2016. I was at a conference and I learned of facility dogs that were working in a courthouse, fell in love with the idea that this would be amazing, right? And then the job I was at then, it didn't work out. When I came to Dunn County, one of the first things I asked Wendy, she's probably like, oh man, I was like, so I really want to get a dog to bring them, back and forth to work with me to engage with the clients. And so it really started for me personally, started back in 2016 when I learned that this was a thing and an opportunity. I brought it to Wendy. I searched for organizations that were reputable. Helping Paws follows the dogs. Like I'm still required to, you joke about her being skinny, like that's probably one of the only reasons they remove dogs is if they're not taken care of health wise. So I still have to go once a year in person and so they can have eyes on her. I have to turn in not health reports, vet records and ensuring all of those things. So they're a wonderful organization. The dogs are, you can train your own dog to be a therapy dog. I think the requirements, there's not a lot there, but I wanted a dog that was going to be fully trained and appropriate to be with clients. So I brought it to Wendy and then Chris Corpola was the manager at that time or the director and brought it to her and kind of presented that and presented the plan. It was not too difficult because the sheriff's department already had the 2 K9s plus rookie at that time, so that was helpful. So yeah, I don't know what the plans are post Esprit working. They work till they're about 8 or 10, depending on the type of job that they're doing. So
I was going to say it's about 10 years on for this program, so congratulations.
thank you.
Yeah, any other questions or comments? Supervisor Bashan or Ms. Rudy, any questions or comments? Apparently not. Perfect. Thank you very much.
Wonderful.
I think she's being a hair modest. I'll tell you a little bit. It'll only take a second, but Stacy ended up in the middle of COVID looking for an internship for her therapist position. her clinical hours. And she ended up calling me on a whim and said, hey, I need a last minute internship. It fell through. And so she ended up doing her internship in a summer block. And in that time, we ended up needing a therapist. She got hired, and then it was like all of a sudden the dog came, and it was just really cool. So it's just Stacy herself is a go-getter and gets things done. So
Sure.
it's really awesome. Yeah.
Thank you.
Yeah.
Yeah, congratulations.
Yeah. Okay.
Okay,
You want me to go
Randy,
on
are you
C-
ready?
I'm ready. You want me to do CSP first?
That's what I got up, so I'm hoping
you want me to Okay.
do that first.
So infographics. These have been fun. I'm passing these around, correct? Yes. Okay. So CSP is the Community Support Program. This is a program that we've had in Human Services since about 1982. I think that's when I can hear data, I can find data. This program works with folks with severe and persistent mental illness. 18 years and older right now is the age range. A couple of variables that need to be present is they have to screen eligible on a state functional screen, a state mental health functional screen. And there has to be some symptomology in the mental health realm that many times includes psychosis. Does not have to, but many times it does. So that's this program. So this infographic was kind of, I didn't even keep one for myself. Share with me, Stacy. Yeah. So I'm just going to review this. Is that what we want? Okay. So budget wise, net expenses were $576,000. Revenue sources for this program, they're all noted there. The primary revenue resource is Medicaid. It's a Medicaid
Mm.
created program. We also are able to build family care like Inclusa. And then there's a little bit of private pay and something called medical supply. And I should know what that is. Right now, I do not. So this revenue resource includes, okay, let me back a little bit. So CSP primarily includes case management, also includes employment support, and then our clinic services. So it could be medication management or psychiatry, and then therapy with one of our clinicians like Stacy. In this number of revenue, it includes our clinic's provider services. So anything in the clinic is included in this. When we get this beautiful thing for 2025, you'll have that separated and it'll say, what did the clinic do for budget versus CSP as a whole? Then that leaves county levy at $226,174. You'll see at the very bottom, we closed on a positive margin of plus 15,595. So 2024, we did really well. The AMSO indirect costs and total share costs are there on the left. I will not read those. You can see those. And then I think it's really important to note, one of the things that CSP does is we work with a population that has a tendency to interact with emergency services. So it is our strong opinion, and there's data behind it that shows that CSP in itself, the ability for this program to serve clients, decreases costs that are much more costly, and they're funded by tax levy, state hospitals, group homes, and then the crisis line.
Sure.
So those are noted there because I think it shows sort of that teeter-totter of balance. CSP services are noted on the right, really high advocacy and coordination of care, crisis intervention and support, psychiatric symptom management, nursing, psychotherapy, and then socialization and skills development. That is our CSP infographic. Questions? Or
Well done.
Thank you.
Nice and clear.
One of the things that Wendy has been advocating for is that private insurance also supports this program. Working with the state, trying to move that forward. We're still working on that. It's not accomplished yet, but it's one of the areas that we're really hoping that we would be able to build, just like a birth to three service for speech
Mhm.
therapy or those types of things.
Mhm.
So she's working hard on that piece as well.
Wendy, would that require additional staff? I mean, assuming that you had an influx of private pay or insurance, private
So-
insurance?
Yeah, I think that's a great question. So we already are serving the population in some capacity. It's how do we optimize the revenue resource and name the program correctly? So CSP is a Medicaid program. If we have somebody come in with commercial insurance, we have to change sort of the name of the program. And so we're working on like, how do the ins and outs of that look to ensure optimization of revenue so we can ensure that clients all get the same services.
Mhm.
So yeah, it's a work in progress. And right now we're doing it. So it's just, how do we do more of it?
Yeah,
And do
sure.
it well? Yeah.
Mhm.
Thank you.
Yeah. Any other questions on the CSP infographic?
Any questions? Dr. Hall?
Thanks. Can you tell me a little bit about the socialization and skills development kind of work that happens? Just give me an idea of what that might look like. I'm just curious.
Absolutely. So the first thing that I'll attend to is we have social groups. So right now we have a wellness group that's, I'll just say nearly weekly. And then monthly, there's a cooking group. So we bring together any of the clients that want to come. Of course, they're voluntary. And as much as there's a skill, or maybe in the wellness group, there might be psychoed, there also is the socialization component. We also do every other month a bigger event, so like an adventure or an outing, and then there's always a picnic in the summer and then a Christmas party in the winter. So we just had our Christmas party yesterday and it was really cool. We had 12 clients out of like 25, so we're almost at 50% attendance. So even with that, so those are the bigger group activities. And then there's also the smaller ones where case managers are with them or the social workers are with them as they navigate resources in the community, as they're navigating benefits, as they're navigating doctor's appointments, things like that, and really just there to help them communicate their needs socially. Yeah. The other thing we've been doing recently is connection with Kaleidoscope.
Hmm.
I don't know if you guys have heard of Kaleidoscope, run by Milkweed. They're going on tomorrow, that's our wellness group. And how do we connect more of our community resources? Because not everything has to be with your case manager, right? How do we build some natural support? So yeah.
Thank you.
Yeah, definitely.
Any other questions on CSP? Go ahead, Wendy.
Perfect. Okay. Next, I get to share about our clinic. The clinic. So this is where Stacy works, or is a part of. So upstairs, we have an outpatient mental health clinic. This is a clinic that's certified through the state of Wisconsin under DHS 35. With that, we do have the ability to bill Medicaid, Medicare, and most commercial insurances. And then we also have ability for private pay. It was kind of cool to put this together and think about the priorities in our clinic. I'm going to read through those because I think they really emanate our clinic. Many times we utilize the terms county mental health, and it's like, what does that mean? This is what it means. Our clinic works with folks experiencing severe and persistent mental illness. They have to be a Dunn County resident. Right now, we're serving residents that are 11 years and older, uninsured clients, so clients that are not able to get insurance or they've had a lapse, those sort of things. Clients that have been terminated by private mental health clinics. Collaboration with clients who have other county services or providers. That's really huge. There's many times Stacy's going to team meetings or collaborating potentially with like a psychiatrist at another clinic. I think it's so important for that holistic care, particularly in mental health, and those that are underinsured. Revenue has been interesting for the clinic. Just this year, Paula and I worked to separate the clinic budget because it was included in everything kind of like the catch-all for behavioral health.
Mhm.
So it was hard to know, what is this outpatient clinic doing for revenue and expenses versus the rest of behavioral health? So in 2026, we'll have that number separated. And I'm excited about that because I think it's going to change our perceptions. Here's what I've got for data for 24. The clinic had revenue of nearly $600,000. And the biggest pocket of revenue was our CCS population, the Community Support Program. No. Comprehensive Community Services Program. We also bill a lot of commercial insurances and private pay. That's almost $200,000, that 184, and all of the insurances are noted there. I always find it confusing that there's so many Medicares and so many Medicaids when they're government insurances. So it's always interesting to me, but we do bill all of those. And then CSP revenue, as I stated in the other infographic, we didn't have that separated in 24, but we will have that separated in 25. So we'll be able to see what CSP clinic revenue is. Actually 25 will have CSP. Yeah. They just have to separate it. Yeah. But Expenses we won't have till 26, yeah.
Mm.
So I thought it was really interesting to show how many appointments were attended, and that's very important. County Mental Health has a high number of no-shows or cancels or those sort of things. In my time as a manager, maybe even with Stacy's time here, probably in the last 4 or 5 years, this has actually decreased. When I started, we were at a 33% no-show rate. Now we're about 25%. So that's 1 in 4 appointments. You probably feel that more days than others. So I thought noting the attended appointments. So how many times did clients make it in? And for either psychiatry or therapy, 836 appointments for psychiatry took place in 24. Nearly 2,000 appointments took place for therapy. And then our nursing appointments was nearly 300. Total appointments are 3,106. And then unique clients served, so this is that single client, nearly 500 clients were served in 24. Expenses, so this kind of summarizes what I shared at the beginning. Clinic expenses have been pooled with the entire behavioral health section expenses, data collection, and the new ERP will provide specific clinic costs in 26. So when I present this next year, we won't have expenses, but the next year after we will have. Yeah,
Perfect.
cool. Any questions for me? Or yeah, Paula.
Any questions for Ms. Winger? Online, any questions? Thanks, Michelle. Great. I actually really, I know this takes time in our meetings, but I actually really love the fact that when we look at budgets, and it doesn't necessarily mean anything, but to look at programs and to get a kind of real human sense of the important work that you do. And these infographics are very helpful in making it simple for us, which is
Yes.
required for some of us.
Yeah.
I did not look at you. I looked at Dr. Hall.
If I could add one thing, well, maybe
Please.
2. This has been a good dive for me as the manager. I've overseen these 2 programs for 6 years. So being able to pull it apart and ask questions, it's been a labor of love. I bet these have taken me 3 weeks because I thought they were done. I actually said to Stacy and the clinic team, they were like, whoa, what about this? So it's been really great for me as a manager to build this awareness. So I've appreciated it. I want to say there's, you guys have heard about choices in the FEP program.
Mm.
So we're aware there's no more grant. Paula and I chatted just earlier today, and I wanted to make sure I mentioned it. So this program is being sort of morphed into the clinic. It's going to become a service under the clinic. Not specifically, I shouldn't say that. Therapy and psychiatry are already serving this population in some way, shape, or form, but we're going to build in that employment specialist into the clinic. And we're going to continue to serve this population. And along with that, I have a goal and hope to build the training in psychosis, and I'll say dissociation, just because I think they're very closely related to all the clinic staff and CSP staff so that we're able to sort of optimize our services. So we're going to continue to serve this population. It's just going to look a little different.
Good for you.
I just
Yes,
have a question. real quick.
Supervisor Hagan, please.
Thank you. With people who are a part of this, the clients, what is the turnaround rate between when someone requests assistance to getting back to them to having them like start the program? What does that look like?
And you're talking about the clinic?
Yeah.
Yeah. So our goal, so the first step is they make a referral, and that date starts kind of a timeline, if you will. Within 7 days, our fiscal person makes contact and figures out the financials. She usually does that within 1 business day. And then from that date, within 7 days, business days?
Oh, I think I just.
Within 1 week,
Yeah.
one of the therapists is picking up and making an attempt to call. Then from there, usually the therapists are trying to get someone scheduled within a month.
Okay.
And then from there, so the first step in the clinic is always through the therapist. And then they can see the med management provider, psychiatrist. She's not a psychiatrist. She's an APNP, but it's psychiatry. And she can usually get someone in within, I'm going to say a month, usually 2 to 3 weeks, unless she's had some vacation or there's a holiday. I think we're doing very well compared to what we're hearing with private providers. Yeah.
Sure. Yeah, that's fantastic. Thank you.
Anything else? Dr.
Yes,
Hall,
ma'am.
please.
So if someone who had private insurance wanted to use Dunn County's behavioral health clinic,
Yep.
because you have better access than some of the other local providers, is that an option for them?
It is an option. The first thing that our referral folks are going to say is, have you tried community resources? Is there a reason for our clinic? So we always want to try the private resources. And if they're like, I just can't get in, then we
Mhm.
would be able to take the referral.
Okay,
Yeah,
thanks.
absolutely.
Anything else? Thank you both very much.
Yes.
So appreciate it.
Thank you.
Extra ones will go to Diane for the.
Yes.
executive.
Yes. And you cannot leave unless you take cookies.
Oh,
That's right, I promise.
Greg has them. Greg is passing out the cookies. Yeah, thanks.
Thank you, Diane.
You're welcome. Thank you very much.
Put it right.
Okay, thanks, everybody. Moving on. Merry Christmas. Veteran Service. Yeah, so Quinn, you are
Yeah,
on.
all right, good evening, everyone. Really Merry Christmas. I will start my report off with just kind of describing what's going on locally at the state level and the federal level in relation to our veteran population. So the first item that I'll identify and go over is we didn't have a meeting last month, but
Right.
just successfully report that our office participated in a number of local veteran celebrations, and certainly not within our structured job descriptions to conduct celebrations. However, it is within our presence duties to show support in the community and to identify our accessibility and our support for what some of these local parties that have these celebrations. An example, we historically have always attended the Menominee Middle School. Can't say enough nice things about how they have put together and structured their Veterans Day celebration and involved the community. Absolutely excellent celebration. And then the Menominee, the Senior Center, that particular event seems to be drawing more and more individuals. And it was very, very nice attending that, and had a veteran that we support and assist in some other programs throughout the county. Support and assist was actually their speaker, and she volunteered and kind of in conjunction with just being able to talk a little bit about her experience within serving in the military, and I gave and I think Paul's aware of this, as well as Tracy Winger. One of their staff came and attended, that it had helped, and it really went a long way. Very, very evident for this veteran to have that support, in she just reached out, and to then have somebody recognize and know that they would like the support, and they followed through. And it was a nice gesture, nice to see that. And then we kind of wrap things up with the neighbors of Dunn County, and their staff over there make it very easy to participate in that, because they just with pulling all of the veterans there, and in their main building, as well as the invitation for their family members and loved ones. It's just a nice remembrance, as we watch the different generations of the younger veterans with a high level of energy, as we then move into our older generations, who a lot more reflection on and wisdom that they like to pass down. So it was a nice day. Also, just as far as development and stuff, I mentioned some stuff about generational knowledge and encountering. I credit our human resources team. We've had a couple generational leadership trainings, and it's very good, both at all levels, to have a good understanding of how different generations think, how they work, and that, I think, it just enhances the team. I found it valuable. That's why I thought it was good to put on there, and I think there's probably some additional thought about continuing with some of that for the future. Also on the program advisory committee, Bachelor of Science Rehab Service at UW Stout. And I think I found my way onto that group quite a few years ago. I think by chance, just because of having some number of interns that come through a variety of programs through UW Stout. Even though it's been a bit since I've had one, and it just to get some input of folks out in the community, because that's a program that trying to continue to keep the numbers high. They're just looking for some information and what individuals, other ideas on how to attract students, how to retain students, what's the job market like. And I think they're one of many programs, I'm assuming, that are looking and soliciting that feedback from the community. On the state level, I finished up my tenure as the president of our County and Tribal Veteran Service Officer Association. It was a great. We have a banquet that, all kinds of recognition awards, longevity for individuals. But we had one of our local veterans was a speaker.
Nice.
Yeah. Howard Hayden, and it's all right that I say his name. He wrote a book. He three Purple Hearts, earned three Purple Hearts, which means he was hit with enemy fire 3 different times, and there's one that's missing that they lost the paperwork on, because he
actually has 4.
heavy count, but just a delightful individual, and he was our guest speaker, and it was nice to hear and just kind of reflect a little bit about that the era that he served in Vietnam, and so it was good. So that was on my end, being the outgoing president, to be able to have one of our local veterans speak that really has a lot of credibility for his service and his experience in life. And then also submitted each year, we have the opportunity to get some reimbursement for a transportation program. Our transportation program, we work with the Dunn County Transit, but within Dunn County Transit, it falls underneath the ADRC, and so they line up the drivers, bill the veteran, bill us. We share payment on that, and so we're able to get a little bit of reimbursement. It's ranged over the years, $600 to $900, and so we submitted that grant application. We already got our reimbursement check, just came down. It's like $800 some dollars. I won't deposit it because it's budgeted on the 2026 budget. So it'll get deposited after January 1st. And then the other part, the federal benefits, of course, I think we were all impacted directly, indirectly with some of the government shutdown, and I had to put out our reaction to that was, well, here's something we can do. We're gonna go ahead and pick up some food cards, spread it out within the community from some of our vendors with Dick's Fresh Foods, Marketplace, and so we purchased some cards, set up just a simple policy that you have to prove that you have food share, number of people in your family. We give you $50 per member, not to exceed 200. We got one request, but
Wow.
which tells it that families are resilient in preparation. We have the funds don't go anywhere. So we're postured and able to assist, and I'll report a little bit later on what we're seeing as far as an uptick in the need for assistance, but it's taking action, trying to do something. Thankfully, things resolved itself, but we had the attempt, and we had a request, and we took care of the family. So those are just things, and I just want the board to know that we have the ability, we pay attention, we try to be a good partner, because it was more than just our small little department that immediately was trying to provide some relief support
Absolutely.
for folks. And thankfully everything worked out and was resolved before things really got too dire for the folks we help.
Greg, the news this week indicated that the Veteran Service, the VA, is dropping 35,000 employees in the healthcare arena. What do you know about that?
Uh,
And, how do you think it will affect us here?
You know, probably as much as I know
Okay,
about what's put out in the media. What I can tell you is, um, what what's happening now. What's happening now is our healthcare and it stems in our area. Uh, our catchment area really ranges from Minneapolis, which pulls in the Maplewood Outpatient Clinic, Rice Lake Outpatient Clinic, as well as the Chippewa Falls Outpatient Clinic. We have some individuals choose to use Toma, which then pulls in, I think it's Owen. Owen, I think, is the outpatient clinic. So as far as the healthcare, haven't had any veterans that have had concerns outside of normal concerns that they always have. Um, and but the part in anticipation of what is a likely outcome from this, because everything, it takes a bit for
sure.
us to feel the impact. I do anticipate that there'll be potentially more delays for getting into clinics. Specialty clinics are always burdened. And that's always been a challenge with trying to have enough staff, enough of those specialty providers. That's why there is the community care program through the VA. So what I would anticipate, because I've also read that they're trying to enhance or improve upon the community care program, and in the future they're dividing the country into two, what we'll call them third-party payers for the VA. And I think it's split rather than, I think there's 5 now. We have Optum, which is LHI out of La Crosse, that is a third party payer for the community care outside of emergency or ambulance rides that are paid out of the local hospital. So I anticipate having a better answer, even though I talked for about 5 minutes about it, but a better answer in probably 3-4 months, because I would anticipate that kind of what happens when you make that decision. But in our area, number one thing that kind of fixes everything is the quality of the individuals providing the service. So those individuals are dedicated and they work hard, and that can counteract some other bad decisions or policy and stuff, because their heart's in it. They care about what they do. And I think that will delay the overall effect of in the struggle.
Okay, well,
But
just keep us posted if you would.
The other, I did provide an article. Didn't do a good job pulling it off the internet, but the text within it, just in summary, is the federal government's choosing not to enforce the law when it comes to the what we'd identify as claim sharks. The law reads that no veteran is supposed to ever be charged to submit an original claim. And that is being violated every day. And it's coming more to light now. There's a VA toll-free number that a person can verify their payment amount. And some of these organizations, because when the veterans, like our office educates individuals on that, because we're seeing an uptick, some individuals, they're just not patient. And they're like, hey, these guys said that I can have a mansion down in Florida. Just sign up with us. And so we let them know that you don't have to pay them anything, even if they send you a bill, because it's illegal. And what I think what's happening, some of those organizations have violated by using their social security number, calling that verification line to verify their claim was awarded. Therefore, that triggers them to send them a bill. And so I think that there's going to be some changes with all that in the near future. As an association for the state, it's something that we're trying to get some support behind, because state of Wisconsin, we've got support in every county. So there is no pockets. There's no pockets of lack of service. There could be quality, quality breaks in areas, but there's services that are available for free. So you get an opportunity to read that, and I'll be keeping my eye on that as the future unfolds. I'll jump into the Veterans Served report, and you can track against the retroactive payments. I've kind of identified an impact statement that it's just to give a good identification of the delays and the waits that individuals that they have to go through to get certain things done when there may be some errors in what the VA does, and that then lends to the importance of the support and the individuals that are helping them through the process. In this case, it was us helping them through the process. And I've talked briefly, I know about this situation. I think I've labeled it probably the most egregious error I've ever seen in my 14 years in working on this. Helped a veteran, whole family submit a claim. Veteran passed away during that claims process. There's an approved claimant, which is a surviving spouse, to be able to receive ongoing benefits as well as what the veteran was owed. We proceeded down. We had Senator Baldwin's office involved for a few years to get assistance and support. The VA kept, just an example, a simple example, VA continued for about a year, regardless of a half a dozen letters I sent to them, that the spouse is not the one that needs the examination for the disability claim, because it was the veteran who's passed. So therefore you have to read records. And Senator Baldwin's office helped in that whole process. But then what happened 6 years into that, the surviving spouse passed away. So in how the law reads, there's no valid claimant then. So anything that family is owed, because it doesn't go to the estate, is all gone and lost. And so if they lived in poverty, if they're homeless, nobody receives any of that. Thankfully, there was a valid claimant because one of the children had a disability prior to the age of 18. That makes them, and they're in need of additional support. So that gave me another shot at it. And so we got it done. That claimant is able to receive ongoing benefits going forward, which makes a huge difference. But for the family, it's more about the principle that this, and to validate all along what they wanted validated for their father. It just was such a long process. We're waiting on the accrued benefit part, which should be probably over 100,000.
Oh.
So we're waiting on that amount right now. So that's kind of the good news story, and really why it's important to have that additional support, because the family had every right to. At this stage, they can engage in and sign a contract with a lawyer. That every right, but I told them, like, you don't need one. Hang in here, and you're going to save 40,000. And they were thankfully hung in there, because it wasn't a situation where a lawyer was needed. There are times, this was not one of them. So I was happy that they hung in there and things worked out. And I'll have a report on the when that retroactive money lands, which I'm keeping a close eye on.
Well, and thank you and your staff for this kind of persistence. This is really something.
They give a lot of the VA gives a lot of opportunities to pull out some of the competitive nature. So it's mutually beneficial. Any questions about that? And I'll touch on the budget. The 2025 budget, as we're coming into the last month, as you see, the report I submitted was the report that I used to provide out of SAP. We'll need some updates in the other program that we use. So a couple things of note. If you look through it, it could be significant in our small budget, may not be in others. But if you look at overtime, we're authorized $300. You can see that we went over by $54.60. That could be significant if we didn't have money within our grant program. So, and I've got a meeting scheduled with Sophia to go through and kind of wrap up and just go through and validate everything is good. We're not waiting on revenue like some of the other teammates in here.
Like the
So
health department apparently.
yeah. So there's just a couple things because it shows that we have a bit remaining on our grant. But what we do is kind of work through and get that all zeroed out with some of the other levy dollars. So everything should be good based upon my review of this. And I don't have any changes to report as we head into the 2026 budget. I think everything is pretty standard from what was submitted. Any questions for me?
Yeah, any questions on the budget or other items for Greg?
Just to thank you for the work you've done.
Indeed. Thank you, Supervisor Kane.
Thanks for letting me do it. Appreciate it.
It's our pleasure, actually. All right, thank you very much. Moving on, Department of Public Health. KT.
All right, so we have a lot to talk about with fees, so I'm just gonna kind of gloss over the report. I did want to pull open, so in the report that was in the packet, communicable disease, I didn't do any kind of regular updates. I just wanted to get the data to you because I think that those data dashboards are so helpful. So communicable disease, a couple things that we are watching that have made national and statewide headlines. There has been a significant infant botulism outbreak associated with By Heart formula. There was, and our team was part of it, a recall check to make sure that they actually had pulled it from the shelves, and they did find that it was not pulled the way it needed to be pulled. And so really thinking about how do we get the messaging out, and then how do we assure compliance so that we don't have continued exposure. So that's something to share with you. And then also, there has been a dairy herd in Dodge County that has tested positive for high path avian influenza. Not unexpectedly, we have seen it in other dairy herds. When you look for it, you oftentimes find it. Again, the concern, not necessarily for people, but really moving between other species and having that opportunity to combine in a way that can make people sick in a new big bad bug. So continuing to watch that as well. As a reminder, pasteurized dairy products, there's no risk. However, if you choose to have unpasteurized products or eat raw meat, also you could also get sick from that as well. So that's the updates for communicable disease. We've already talked about Amy's presentation for UWEC. So I love that our team does participate in growing new professionals. And so you saw that with both Grace and our WIC intern, dietetic intern, and also Amy. So just to be able to show that.
Amy?
My Amy?
Okay. Oh, I'm sorry. I had an Amy that did a presentation in school too. So. Okay.
No, it's KT's Amy.
Yeah,
Okay.
Sorry.
So confusing. So if you look at the packet, you will see her bright and sunny face. And she just really, I think, sells environmental health in that you're doing something different every day. You can have fun. And sometimes you see itty bitty puppies. So
I know that was cute.
Super cute, but also ick. We see
know.
some things that just really like, come on, guys.
It's stupendously gross. I thought,
Really?
yeah.
Yeah, so that was really fantastic. And then you have in supervisor scene, I made an executive decision and did not put all 62 pages of the Wisconsin state application for the federal rural revitalization grant
God bless you.
in your packet. But I did want you to see that rural health and rural health equity from a Wisconsin lens is important, and kind of what the state is looking at for that very large pot of money to hopefully get some of that into Wisconsin. All right, any questions before I turn it over to Jeff?
My only question is there were essentially public health vouchers in our packet.
Yes, and so when we talked about finance, I will show you what that is and why it looks so weird.
Oh, okay. All right.
Promise.
Just checking.
Any questions?
Any questions for KT? I guess not.
Fantastic. So obviously, guys, you all remember Jeff Robb, our environmental health manager, comes and chats with you every year to about our fees using that guidance that you guys have already provided around having a reimbursement for the total cost of the program of about 70 to 90%. So with that,
Thank you, Jeff. Go ahead.
Yeah, so just as a background reminder, so this is our third year that I've come here to kind of say, here's where our time is spent.
Yep.
Here's where our fees are at, try to figure all that out. When we first started this 3 years ago, because prior to that,
I know.
it was kind of willy-nilly. We were just, oh, let's set a fee at this. Okay, let's try that. So when we first came to the board, we said at 3 years, we're going to do a 3-year average. And that's kind of our goal moving forward. In the packet that you have, there are some anomalies with a couple of the programs that didn't use the 3-year average, so we'll kind of go through that quick. But our lodging, campgrounds, body art, pools, rec ed camps are all using that 3-year average. With the note that the new lodging code that goes in effect January 25th will increase our reimbursement to the state because the state raised their
Right.
fees. Yep.
Substantially, obviously, yeah.
Yep. So the program's not using the 3-year average. Retail food. One of the main reasons is now we're doing 2 inspections at those
Right.
complex restaurants, and just improved time tracking data that we get better every year. So
Okay.
in more than one way, we get better every year. So, but in our time tracking too. And then special event campgrounds. This is one me and Amy have kind of looked at and said, a lot of our special event campgrounds are here at the fairgrounds. The inspection's a pretty quick inspection. The code for our special event campgrounds is very small. So the time we spend at those special event campgrounds versus an ongoing campground is a lot different. And so we
Sure.
kind of looked at those fees and said, well, for only spending 30 minutes to an hour at a special event campground, does it really match this fee that we're charging them? A lot of them are nonprofits and trying to, so we're trying to strike that balance between
Okay.
kind of like what we did with retail food with the transients, how we just had the one fee and then we broke it into three
Right.
fees to help it be more equitable for our business owners. So we'll kind of talk through that as we go through. So Appendix A that you have in front of you kind of is our revenue and expense overview. It goes through kind of our program data, 3-year average for those ones that we're using the 3-year average for, and then projected revenue using the proposed fees that's detailed in Appendix B.
Right.
Any questions so far on the discussion or Appendix A?
Any questions? Any from our colleagues online? Any questions? Okay, go ahead, Greg, Jeff.
I know who you're talking. I know.
Yeah, whatever. He's sitting next to you.
That's right. So Appendix B goes through, there's a lot of data here. So it basically has the number of facilities, what our current fee is, what our proposed fee is. And then I put a couple columns like what it would cost to cover 100% of the program, just so you could see what it would take. Obviously, our goal is still 70 to 100. So that kind of goes through our proposed fees that are, if you have a color copy, it's highlighted in a light green. If not, it's in the gray. So it kind of goes through all of that, along with some proposed fees also in our water lab and well delegation program. So I can talk through those quick. So our well delegation, so that's our well, anytime we get a new well in the county, it's currently $75 for that permit. We're proposing a increase to $100. to help. We want to get Adobe Pro to help build that program, help with some well applications, fillable forms, that sort of thing. And 2 of the years I've been here, we've had a HEC intern that has really helped out that program a lot with going out and doing some inspections for us.
Sure.
And has been a positive experience, not only for us, but also for those interns. So using some of that fee increase to do that. Another feedback I got from my team was for the water lab to have a rush nitrate sample option. Because
Do you get those requests fairly often? Okay, yeah.
Yeah, because some people want their results quicker. As you know, we try to batch sample
Yeah.
our nitrates. We try to do our best with our own sampling to try to do that. This time of year, it's kind of a little more difficult. We're not sampling as much, but give people the option if they want to use that proposed fee. And then Appendix C just kind of shows
Helpful.
what comparison to what others are doing. Some of these fees, some of the other counties haven't set their fees yet. So some of the lodging stuff was hard to match up. Some of the counties like Buffalo and Pepin, they just adopt the state fee. But then once they saw what the state fee was for lodging, they said, oh, wait a second.
Maybe not.
So they're going to from what I talked to most counties, they're going to do like 50% of the state fee and then 75, kind of work their way up to match the state fee over a few years for that
Probably less
lodging.
painful.
Yeah. So I went through that fairly quickly. Any questions from all the information you have in front of you?
The chair has a question, but does anybody else? Yes, please, Dr. Hall.
So I was just curious, the body art tattoo places, it seems like it takes us maybe a lot of time and work to inspect them. And so, the fees that we're charged aren't going to what I think it was like 35%. It's going to meet about 35% of our costs. I'm just curious about why it's so high.
Yeah, I think part of that is when I first started, we had 2 facilities. So our time tracking there was pretty minimal. We went up to 7 facilities within the next year. So then obviously we're spending more time doing the plan review, pre-inspection, some of those they're new places. So we're trying to help them doing a lot of that consult work, getting them up and running, spending that time. Then they go out of business. So then sometimes sometimes depending on when they go out of business, when we've spent the time in the program and the licensing years, it might go from, we're only covering 35% of the program this year, but next year we're covering 105. So it depends on how many businesses we have at one time.
And you'll remember that we had a run on permanent makeup. Those are body art facilities.
Yeah. Sure.
And we had a facility in Dunn County that we had many complaints at. So it took a lot of, sometimes those complaints and sometimes that follow-up can take some time, and there's some legal lawsuits and stuff going on. So it was a lot of making sure we're covering our basis, making sure we're giving the data that they're asking for those legal documents.
Any other questions, Supervisor Bashan, Ms. Rudy? All right, the chair has a question, and let me preface it by saying I absolutely trust your judgment and the careful way that you've done this. I'm always just curious, though, about the decision process of not bumping it up a little bit. What is the rationale on some of these for not charging at 100% of our cost recovery at 100%? I mean, I do understand that you've been very careful in your dealing with local businesses, and I think that's sensible. But just kind of help me understand how you decide that.
It's a long process. A lot of
okay, and maybe I shouldn't have asked.
No, it's a good question. So I think it's partially because partially what we talked with Body Art is businesses come and they go. So it's kind of hard to judge that. A lot of our time is spent, especially in the food program, of consulting with businesses that never come to fruition.
Sure.
So do we put that burden, that cost burden on a business that's doing it the right way? Or we have a food truck that's unlicensed, we got to go do the enforcement, spend all this time, they never get a license. They move out of
Sure.
the county. Do we really want to put that burden on the facilities that are in Dunn County doing the right thing? So
Mhm.
going fully to 100%, there's some pause for that
Mhm.
reason.
Yeah, that makes sense. Thank you.
That's exactly what I would have said. And I do feel very strongly that we don't want to penalize our operations that are doing it well by throwing in the cost for the folks selling tamales out of their trunk.
Yep. Yep. Got it.
Yep. And this,
Oh,
yeah. And one reason we are raising fees in the food categories are just like DATCAP raised their fees with the lodging code, they're opening just the code for fees for food. And they won't tell us how much they're gonna raise fees yet. So some counties have just said, we're gonna guess they're gonna be the same as lodging, so we're just gonna jack up our fees this year and make up the rest the next year. So without the data, we can't really
no, right.
do that, but we'll see what next year brings.
Okay. All right. Anything else? Okay.
So we do have this agenda for information and for decision.
Yes, we do.
And so I would like to ask, is this something that you feel comfortable making a decision on tonight? Or do you want it to come back as a decision item at a different date?
I was actually making the assumption that we had enough information that we could act on this tonight. Yeah.
Okay, thank you.
All right. Moving along. Department of Human Services.
Right. You had my report in your packet and you had the bright spot and Wendy's infographics. I'm not going to take a lot of time to go over what was in my director's report, but I did want to just highlight a couple of things. Economic support, SNAP continues to be on the front line of changes and benefits. I listened to, Becky and I both listened to a conference call today that was national regarding SNAP benefits, and Minnesota just received a letter yesterday stating that they were going to have 4 of their counties' cases reviewed, and 2 of them were large counties, 2 smaller. The larger counties, what they said is you would have to meet with your consumers in the next 30 days, and it meant 1,800 face-to-face meetings with consumers in the next 30 days. And so why Minnesota? And are we next?
We can
Right?
speculate.
So we can speculate. There was a lot of speculations. They are part of the group that said, no, we're not sharing our information. They did have some audit issues with some of the fraud, but it was because of errors, not consumer fraud, those
Right.
kinds of things. So between all of that, that's going on, but none of us know, will that be us tomorrow, and how do we handle that if we do get that kind of letter, and where we go with that. So we're just really keeping an eye on things, taking the temperature and see where does that impact. Today, I mentioned that I met with Representative Van Orden's office, trying to do work on that back end of things. And in the meantime, our staff are hitting high numbers of calls and cases and trying to move things forward. And they're doing an awesome job in the midst of a lot of different changes coming down at them. Also wanted to report underneath the fiscal section, just to kind of highlight there. From the county level, centralized finance has been here longer than me. I'm not sure how much longer than me, but for some time. And when that happened, there was a movement of all the financial staff to move to centralized, right? And so they're taking a look at this now to see, is there staff that are directly providing work for the departments, or are they doing work of centralization and those kinds of things? And so there's been lots of conversations, lots of meetings, lots of documents that have come out on that. And as far as human services, we do have 4 direct staff that do only human service billing for our clinic and our CSP and our other programs. And so those staff and the work that they're doing is some of what we're looking at, in addition to maybe some of the other tasks that some of the staff are doing, but not full-time human services. And what does that look like?
Yeah.
I've been part of all those conversations. We've had great conversations, and I kind of put a summary in my report, but I wanted you to know that we're still looking at that. We've kind of hit the pause button right now because we don't know what all the efficiencies will be with the new system, what will come out of all of this, how will this work? But we're going to continue working together. We're hoping to move those 4 staff down to our department and continue to do a lot of really good teaming and uncovering of fiscal things, as you heard Wendy tonight.
Yeah.
That exercise took her a long time, but she came out of it going, wow, I really know a lot more
Right.
about the financial pieces of the unit. And that's what we're hoping for. And we hope that if the staff are right here, we can have some of those, one-on-one conversations and build that. And I will be part of those conversations as well, digging into the financial end of it. So I think some good things to come. We've got to figure some of those pieces out yet. So part of it is, looking at pausing that, and part of it is really digging down deeper and seeing what efficiencies through new systems, or how we can maybe do this a little differently.
It does make some sense, at least to me, to figure out how to do it right
Right.
instead of just doing it.
Right. Not to rush into it, but really look at
Yeah.
that and see, and then, where are we at through this process? So
Yeah.
that's where we're sitting today. I don't know, Dan, if there's anything you wanted to add to that, but that's okay. Sounds good. Any questions on that?
No.
We'll keep you updated. Okay. There's a lot of good shout outs, so just knowing that piece of it, but I don't want to take more of your time.
You want to talk about the APS?
Oh, yeah, I can talk about APS, certainly. There was the graph in your packet here where we showed the high increase in numbers. We're sitting just a little bit under right now where we were in 2024. But I also want to say, the numbers don't tell the whole story. We have had a significant increase in individuals with really severe mental health issues that are also falling underneath the adult protection umbrella. And these cases are so complicated, and we're working with multiple systems. We're getting a lot of referrals from like the state Department of Corrections coming back from prison and entering our systems. We're getting a lot of homelessness with people with significant mental health that aren't able to care for themselves. And we're doing, is it cognition? Is it we're like they kind of all intertwined. So the days of some simple I don't have the resources to care for mom in the house. I mean, we have those, but those are more rare compared to these other really complicated cases that we're having. So the numbers keep going up because certainly we are out doing some of those. Here's resources. Let's connect you with ADRC. Let's do those things. But there is a much higher number of protective placements, guardianships, fraud with providers, or concerns over power of health or finance taking advantage, investigating those types of things. So they're just a lot higher acuity and concerns, and work with that. So we did move. I did talk to Dan about reallocating resources. We did have a vacancy in family and children's, and we moved that position into adult protection because it was tax levy and we were able to move it over. That doesn't fill the need. In family and children's, it's a truancy position, so we're looking at how do we then do some of that, and using the staff that we have to kind of fill in those holes. But it felt like the risk is much higher in adult protection when you're looking at some of these cases for liability and safety compared to truancy. Truancy is important, don't get me wrong.
Right.
It really is important, and we work hard on that in Dunn County, and I think do a pretty good job with that. But when I look at liability and risk, and we were just so far behind in getting out to cases, we had to make that move. So we're looking at some of that within the department and trying to figure out reallocation because there is no new, right? So, so I don't know if you have questions on that piece either.
Any questions? Any questions? Okay, but that was well done.
Yeah, thank you.
Yeah,
And then can I share the financial
please.
report with you? All right.
You want it?
So we are a week early, as you know, in our time frame of looking at revenue expenses for us. And so when Jerry put this together, we met with her and reviewed all the reports and where we're sitting. We want to make sure that you are aware it's not a full picture, even for October, because we haven't received all the invoices or revenue at this stage of the game here for December, right? So there is a significant change from when you've seen this 2 months ago, which was great news. Some of that was some of the projections and things.
Excuse me.
Jerry went in and reviewed some of the things that were done previously. I'll leave it at that. And so this is the new number that we're looking at, but we did take a deep dive of like the why behind this. And so in doing that, we are over budget $387,000 for residential care facilities. We are over budget 95,000 for institutions. Now that's over what we budgeted, not just what we spent. And then at this juncture, we looked at the compensated absence payments. So this is staff, like if somebody leaves, how many benefits do they have on the books?
Right.
If somebody has more sick leave than what's allowable, they get paid for that. So there's some of those types of things in here, and we're over budget by 113,000 plus some for that. So, you know, kind of adding that all together, those were our highlighted areas of the overage. Certainly we're under in some other areas, right? Because this is more than the 258, but that's where we're sitting today with that. She also did mention that WIMCR is projected as a 5-year running total because we never know what that's going to be and we get it for the year after.
Right.
So she said she's not sure that WIMCR is actually going to come in at what was projected. And so kind of like that piece could look different too with the revenues. So don't be surprised if this is fluxes a little bit with that piece of it.
Right.
She did hear from the meetings that some counties were getting notification of some WIMCR payments coming out. So hopefully we'll see some of that. We'll see. Ours hadn't come out yet at that time when we met with her last week. So any questions on the financial piece?
No.
Again, we'll know more in March.
Yep. Yeah,
Yep.
we were expecting this.
Right,
Yeah.
right. I kind of feel a little bit
I know it's
good
not as
about it
bad.
because it's not as bad as what we
Not
thought.
as bad.
So it's a matter of perception, but it is sad. So,
Yeah.
all right.
Yeah.
That's what I have there. Thank you.
All right. Any questions? Any further questions? All right. If not, thank you, Paula. Becky. We have several items to approve or note. I'm going to take these one at a time because we have DHS vouchers for both October and November. Let's look at October. The amount is $408,624.71. I need a motion to note review, Dr. Hall.
I so moved.
Supervisor Steen seconds. Any clarification needed? Any additional discussion? We've looked at these every month for years and years and years. All right, all in favor of noting review of the October vouchers? Aye. Any opposed? All right, the October vouchers are noted. And then for November, the amount is $560,186.60. Without the need of any clarification, I'll take a motion to approve. Supervisor Hagan, is there a second? Dr. Hall seconds. Any additional discussion required? All right, all in favor of noting review of the November DHS vouchers signify by saying aye.
I,
Aye. Any opposed? All right, noted review. And let's see, the next item is the public health budget adjustment. And KT, since neither Michelle or Polly, could you go through this, please?
It's not the document I want. Let me get to the document. All right, so what you have is the budget adjustment, and my apologies, there was some back and forth about what we were doing with this. I thought it got in the packet, it did not. So my apologies. So this is something that we talked about back in October.
Mhm.
We had gotten forewarning, I think is the right word, that there was going to be a reallocation of unspent funds for Title X. And you'll remember that Title X is federal pass-through dollars for reproductive health clinic services. You will also remember that our Title X budget had been slashed over the last 2 years. So this number changed 3 times. When it finally got to us in contract, it is $59,000. And so this, which is nuts. Can I just say that is nuts? That is more than we got in the beginning of the year. It puts us on par to be funded at the same level we were 3 years ago. However, we didn't get it in time to spend it in 2025. This
Right.
goes until, so the grant year goes until April 1st of 2026. And so my ask is that we are approved to receive the funding, and then we will spend it appropriately on items for the public health, reproductive health clinic in that first quarter of 2026.
Perfect.
The other 2 items are, and this is my fault, the United Way, we actually received 2 United Way grants. One made it into budget adjustments, and one did not. And so this is a fix, and I apologize. If need
No
be,
need.
we can float it in revenues, but my hope is to get that. And then peer counseling is the same situation as Title X. We were slashed with our SNAP Ed benefits for WIC. And this is a reallocation of unused funds from throughout the state. It is a small amount, and it puts us closer to our original budgeted amount for WIC. Any questions about that?
Any questions on the budget adjustment? Supervisor Steen?
No,
No? Okay.
make a
Anybody?
motion, we approve it.
Supervisor Steen moves approval of the 2026 budget. Supervisor Hagan seconds. Any further discussion, any questions or clarification needed? If not, all in favor say aye.
Aye.
Aye. Any opposed?
And then you had asked about finances, and I forgot to lift them up. I'm so sorry.
I know, and I was just thinking that.
Yes.
I'm sorry.
You want me to
No,
talk a little bit
my
about
fault.
what's in your packet?
Yeah,
It
please.
is, I'm gonna say operator error, but
Could be the chairman's error.
no, that you're actually seeing what you're seeing. So ZFM 10 is the report that we typically use, I would say weekly, if not more often, to look at where we are year to date. Come on, friend. And this is a screenshot of everything condensed. And so
Yep.
you can see in that screenshot, we are continuing to be underspent. We expect that, and we expect to finish underspent. And so I can expand all of these and see that's exactly what Greg prints off for you. For the life of me, even after I phoned a friend in finance, I could not get it done. What I could print was the KSB 1, which is the other 60 plus 26 page document that's in there. And so what that showed is really all of the expenses year to date.
Yeah.
So you could see them.
Yeah.
Again, operator error. There's obviously a way to do it. I could not figure it out. And so I wanted to make sure you had some itemized detail,
Perfect.
but I'm going to figure it out before the next meeting. I promise.
Okay, and the vouchers?
They're not vouchers. They're the expenses for the public health department.
Got it.
So they're not just, it's the whole department and the whole expenses so that they sum up to basically what you
To this.
see here.
Okay, all right.
Sorry.
No. No, I'm sorry, I forgot to push you on that. It just flew right by. All right, and now we need to talk about fees. What we're gonna be approving is Appendix B, or at least what we are considering is Appendix B, with the proposed fee structure. Yes, Dr. Hall.
I move to approve the proposed fee structure.
Thank you, Dr. Hall approves. Is there a second?
I second.
Supervisor Hagan seconds. Any further discussion on this? We did have a nice discussion with Jeff. Any questions, any clarification needed, anything? All right, well, good job. And all in favor, say aye.
Aye.
Any opposed? The fees are approved and can get done by the first of the year as needed.
And one quick clarification.
Sure.
If you really want us to explore 100%, or I do want guidance around that, I do feel very strongly, but at the same time, I know that this is a really difficult budget year. Next year is going to be similar. So let's have that conversation in its entirety so that we can move with the recommendations of the board.
Yeah, I think that's a good idea. I mean, and I do understand, and I think you've done a really good job of trying to accommodate local business, but since budgets are so tight, sometimes and some of these increases are pretty minor, but yeah, Dr. Hall.
It was really interesting to hear about how sometimes a lot of the time in the work is upfront, right? Consulting with
Mhm.
people who are then maybe going to apply for a license, who then never apply for a license. And so thinking about it makes sense that you want to do that consulting upfront so that then they're going to be more successful with their license application. But then if there's never any recoverable fee because it all falls through, so it's like, can you charge for consulting? If I don't
Yeah,
think you
right.
can. I don't think there's a good answer to that.
Yeah.
And you will remember, we now have a plan review fee for folks that actually make that application, and it kind of recoups some of that cost. It's really the folks that are like, I've always wanted to have a hot dog cart. It's going to be my retirement plan. The first time they, go look at how heavy that thing is and they have to get it in and out of their vehicle or the tow on their vehicle, they're like, oh, that's a rough idea. Maybe not. And so I think those are where we see a lot of those. We're grateful to give them kind of a bigger picture, but before they spend the money, but we don't recoup those costs.
Go ahead, Dr. Hall.
This may not be helpful because it's just off the top of my head, but I won't belabor the point, but I think about, is there an opportunity for, hey, we're so excited you're interested in starting this new business in our town. In order to start this process, please watch this online orientation and complete this quiz. And then once you've passed that process, then we'd be happy to meet with you. I don't know if that could shave some of the work off.
So do I hear you offering to do the video for this? I
Dr.
think
Hall
it's
is
a
the expert
fantastic
here.
idea. No, and I appreciate that. Have you
good
considered,
suggestion.
maybe not the quiz portion, but I think, like you said, we can do better to help coach on that business plan, because it's a lot of work.
Yeah. Yeah, and at some point, maybe we should just sort of explore the rationale, the thinking in a maybe more detailed way, but at least you have this now to move forward. Anything else from anybody? If not, we are adjourned. And Merry Christmas to everyone and get well.
Yes, everyone have a great Christmas. Enjoy your family.
You just did?
Fully engaged in the whole.
Yeah, I saw you.